Okay, so here we are. This is the last week of class. We're gonna have a test on Friday, which will wrap the class up, which means your work needs to be in, your quiz corrections need to be in. They should have been done already. So if they're not, you're running out of time. Um, so, lung cancer. 1/3 of all cancer deaths are due to lung cancer. All right, so it's a pretty common cancer. Most of the time with this common cancer, most of the time it's linked to smoking. And I wonder if that is that people actually do the smoking or even secondhand smoke. I don't know. But anyway, 90% of it have some type of a smoking history associated with that. And then we know that metastasizing, a cancer that metastasizes is one that travels. And so um, when it travels, um, that's due to the vascularity. Yeah, yeah, the vascularity of the lungs. So um, we don't want little pieces hitting the bloodstream, traveling other places, getting lodged somewhere, and then replicating there, and that's a metastasis. All right. So lung cancer, with it being so vascular, the lungs being so vascular, the opportunity for it to travel and metastasize is very high. So squamous cell. Okay, we usually see those in the bronchi and the bronchioles, right? We're seeing those in the larger branches of the tree, so we're going to see that more towards the medial section, not so much on the periphery of the lung. We can see here that we definitely have some fluid-filled masses here in the lung, okay? And a lot of times it's filled with bleeding, with blood, okay? The adenocarcinomas, those tend to be in more the periphery of the lung rather than so much into the bronchioles or the bronchi. There are nodules that develop in the peripheral areas of the lung, develop in the alveolar cells and the bronchial glands, right? So smaller cells. You can see out here on the outside of the lung we have these adenocarcinomas. And then the small cell carcinoma um, originate in the primary bronchi. They grow into grape-like clusters in that mediastinum. Oh, goodness. It's an aggressive cancer. All right, and that's the small cell or the oat cell carcinoma, the one you don't want, aggressive. Okay, treatment is if you can, you cut it out, then you irradiate it to stop the replicating cells, and then the chemotherapy is there to continue on making cell replication difficult, stopping cell replication. The problem is that it doesn't just target cancer cells, it targets all kinds of rapidly dividing cells, which we know is a normal process. Okay. So here you can see there's where someone takes out part of a lung or whatever, right? They slice along the rib. They're going to separate the ribs. Going to go in there and take out the section that they need. Okay. Now cystic fibrosis. This is a recessive genetic disorder. Okay. So this is excuse me. This is something that they would test for when you're pregnant. Okay, you can test for this to see if your child has cystic fibrosis. Okay, now we decided not to get it tested when we had our children because um, whether they had it or not didn't matter to us. We weren't gonna not. It's not like we were gonna terminate the pregnancy because they so whatever. So for us, it didn't really matter. But anyway, cystic fibrosis, it's a genetic thing. Okay, so that means mom and dad can be carriers. Okay, and we'll see this. Okay, so it causes the oversecretion of thick mucus that can clog respiratory passages. Okay, so we already know that we have mucus in there at spots anyway, right? We know that. The issue is if we get too much of it, now we're starting to block airways. Okay, so the mucus there is it's a good thing, right? We want it there. It filters out all the garbage that goes there. It catches all that stuff, and then it gets coughed out or swallowed or whatever, right? Well, if we have an over secretion of it and exceptionally thick, then we can clog these respiratory passages. Okay, it impairs food digestion by clogging ducts that secrete enzymes. Okay, so now this mucus also messes with digestion of food. All right, clogs ducts that secrete the enzymes, the food enzymes that break things down. And there's multiple other organs that are affected with the cystic fibrosis thing. Okay. Now, when we talk about being genetic, we have the unaffected carrier father and the unaffected carrier mother. All right, and so we're going to see that it's a recessive thing, right? So carriers are heterogeneous, right? So dominant and a recessive. Okay, but since this is a recessive, you have to have two recessive genes in order to have cystic fibrosis, right? So you've done these things before, right? So these, if you are dominant and recessive, if you carry the recessive gene, then that means you're a carrier. But if both of those chromosomes from mom and dad get passed, then you would end up with an affected child, right? So the percentage wise, when you run that whole square through or whatever, right, is 1 in 4. You have a 25% chance if you are a carrier and your wife is a carrier, or you are a carrier and your husband is a carrier. If you are each a carrier, you have a 25% chance of having a child with cystic fibrosis, a 50% chance of having children that are carriers for cystic fibrosis, and a 25% chance that the child will have no signs of cystic fibrosis or a carrier. Okay. So when we look at this cystic fibrosis, there's a lot of stuff. So when, like if we're just talking about airways here, if we don't worry about this yet, but if we look at this, airways, we like to be free and clear with small amount of mucus to catch what needs to be caught, so it can be moved up the ladder and into the throat to be spit out or swallowed. But here we have an abundance of mucus and an airway that is not open and clear, but constricted. Okay, and when you have all this kind of garbage sitting here, this mucus, it's easy to get infections. Okay, now we're also talking about this is like a mucousy glandular thing. So the sinuses are generally always have sinus infections. You got this thick, sticky mucus buildup in the bacterial infections in these and widened airways, right? All this stuff that's going on here with the lungs. We've got skin glands are affected. The liver ducts are messed up. The pancreas is having blocked ducts there. Intestines can't fully absorb the nutrients. All right, so this cystic fibrosis, yes, it's a lung thing, but when you look at this, it is a systemic issue. All right, so SIDS, sudden infant death syndrome. Okay, sudden unexplained death of an infant less than 1 year old, possibly caused by brain abnormalities that control respiration, heart rate, or consciousness. Environmental factors to reduce risk: sleep on the back of the stomach, firm crib with no blankets or stuffed animals or pillows. Right? Okay. So you hear about this when you become a parent for the first time, and you're just petrified by it because you're afraid that you're going to walk in there one day and your baby's going to have died in its sleep. Okay, sudden infant death syndrome. And so one of the things that they have you do is they tell you to have your baby sleep on its back. You want a firm mattress. You don't want the baby to sink down into there, and they don't want you to have blankets or stuffed animals. Okay, so the big thing is that with the firm crib, the no blankets, and the stuffed animals and pillows, you don't want to suffocate the baby. Like if the baby's not strong enough to lift their head, then you don't want them laying on their face down. If you don't want a real soft, cushy mattress, because if the baby's face would get down in there and they get tired and they can't lift their head, then they're going to suffocate. Same way with the blanket. If the blanket gets over their head, a stuffed animal gets over. That's common sense there, right? So you'll learn that kind of stuff when you have your own child. Asthma. We talked about this: chronically inflamed, hypersensitive bronchial passageways. Okay. Bronchial constriction of the passageways in response to an allergen or temperature changes or exercise, all those different things can trigger this bronchial constriction, all right, and it can be managed with medication, generally like a inhaler or a steroid or something along those lines that is going to cut down on the inflammation. Okay. There's your asthma. All right. So when you are having an attack, the smooth muscle is freaking out in here, right, and causing spasm, and the airway is completely cut down. So hyperbaric chambers, right? Hyperbaric oxygen chambers designed to force greater amounts of oxygen into a patient's blood, right? So we talked about the solubility of oxygen. Carbon dioxide is readily soluble, while oxygen is not so much, right? So hyperbaric chambers, where you stick somebody in this tube and you increase the amount of oxygen around them, the partial pressure of oxygen around them, and you basically drive it into somebody. Now, why would you want to do that? Well, people that have poor circulation, people with diabetes, and have like the ends of their vessels have been damaged due to diabetes, high blood sugar, and blood flow does not get to certain areas. Now, oxygen is very healing. Your cells need oxygen in order to repair and to be healthy. And so, if you can't deliver it there through the pipeline, well, you can stick somebody in a hyperbaric chamber, and you can force the oxygen in there through pressure and drive the oxygen into the tissues to help promote healing. Kind of a cool thing. There's a hyperbaric pressure um, containment thing there as well. You get in there and they just increase the pressure and drive it into you. So, patient breathes in regular air while the body is under pressure. Increased pressure means increased solubility of oxygen, right? Of gases, right? The more oxygen in the blood benefits treatment of certain conditions, right? So, like I just said there, you're just going to be in there. You're going to be breathing regular air, and then they're gonna fill that chamber full of oxygen, increase the pressure so that it pushes into you and in the wounds and whatever else, and helps with healing, right? So when we look at hyperbaric, so tetanus, gangrene, let me think of some. So these two things right here is where we have usually an infection that is not able to be taken care of by the body because the blood flow has been interrupted or not very good. So, or not tetanus so much, but gangrene. And so you're driving oxygen in here. Sometimes this can help with migraines. And here's this slow healing wound, so diabetics with bad circulation. Skin grafts, burns, right? So we know that skin is highly vascular, and you get into burnings, first degree, second degree, third degree burns, or you want these skin grafts to take, driving oxygen in there to promote regeneration, not fibrosis, is only going to benefit them. Stroke, that is a lack of blood flow to the certain areas of the brain, right? So now let's stick them in a chamber full of oxygen. Let's try to drive it back into the brain and drive it back into the body and increase that oxygen level and see if we can't change and promote some healing here. So we have all of these different types of conditions that benefit from more oxygen. Now, here, when we talk about decompression sickness, when you talk about scuba diving, as you go down into the depth, the water puts pressure on your body, right? And so the increased pressure increases the solubility of inhaled gases into the lung, right? So now, when you have breathed air into you and you start going down deeper and deeper and deeper, the pressure gets more and more and more, which drives more gases into your blood. Okay, which not so big of a deal. If you come up at the correct rate, the pressure will decrease slowly, right? So if you've worked your way down to the real depth, and you're like, okay, we got to work our way up, and you come up slowly at different stages, and the way they teach you how to do it, it's not a problem. Okay, the pressure will decrease slowly, the solubility decreases slowly, the air starts to leave the blood, so the gases come out of the blood, and you exhale them. Okay, no big deal if you do it right. The problem is that if you come up too rapidly, the pressure decreases rapidly, so the solubility decreases rapidly. So the gas comes out of the blood too fast to exhale it right? So then the excess gas becomes bubbles, and it collects in joints, spaces, arteries, tissues, causing coronary, pulmonary, or brain embolisms, right? You don't want air bubbles, okay? And so if you just come shooting up out of the depths, you cannot exhale that gas fast enough. It ends up being bubbles, and it gets lodged in the heart, in the lungs, in the brain, and those air bubbles can block blood flow, and we've got an issue. Okay? So nitrogen narcosis is as you descend under the water, the pressure on your body increases, so more nitrogen and oxygen dissolve into your blood. Most of the oxygen gets consumed by the tissues, but the nitrogen doesn't get used by the tissues, right? So increased nitrogen can cause a feeling of euphoria, like laughing gas, and it can impair judgment. So that's something that you have to watch for if you're going to go down deep, right? Is that if you go down deep, that's not a problem, but you have to come up at the right rate, okay? You have to come up slowly so that things don't freak out on you. Now, the problem is if you were down there for a while and now the nitrogen's being driven into you, and now you're making bad judgments, now you're going to will you remember? Will you make the proper judgment? Will you wait long enough to give yourself time? Will you leave enough time to make a correct ascent to the surface? So there's that whole thing there, right? So nitrogen narcosis is due to an excess amount of nitrogen in the blood that is going to impair judgment. So decompression sickness arises when the pressure gradient for nitrogen leaving the tissue is so great that large bubbles form in the venous circulation. All right. So decompression sickness arises when the pressure gradient for nitrogen leaving the tissue is so great that bubbles form. Okay, bubbles are bad. Symptoms are wide-ranging from skin mottling to mild tingling in the hands or feet, shock and death. Recompression in hyperbaric chamber is the only effective treatment, right? So what you got to do is you have to go back into a high-pressure environment, drive the nitrogen, back in, or get the pressure back up so that the nitrogen is not bubbles, and then slowly bring them out of that so that the oxygen or the nitrogen can be exhaled by the body and not collect as bubbles. Okay? High altitude sickness. The higher the altitude, the lesser the amount of oxygen present in the air. Okay, so the higher the altitude, the less the amount of oxygen there, right? So the headaches and difficulty breathing are initial symptoms, right? You get up into high altitudes, it's hard to get a breath. High altitude pulmonary edema and high altitude cerebral edema are life-threatening symptoms. The body responds over time by increasing erythropoiesis to give the body greater oxygen carrying capacity. All right, so when you talk about blood doping, people who run or bicycle and they blood dope, what they do is they either get blood that is from high altitude, people who live in high altitude, because they have more red blood cells, which means they can carry more oxygen. All right, but yeah, you can get swelling of the lungs and swelling of the brain if we're not getting enough oxygen. I think that might be it. I'll look and see. Okay, so these are kind of interesting ones: the decompression, the high altitude, the nitrogen narcosis, all those kind of things. Those are kind of fun and kind of neat to see and learn about. But I'll get some review sheets out to you here in the next day, and we'll work on some Zooms, and we'll get your stuff turned in, and we'll get some sheets to do for some points. But otherwise, just make sure you get your stuff turned in, please. All right. You guys have a good day. I might have some more stuff to lecture on tomorrow, but we'll see. All right, talk to you later. Bye.